صباح الخير طلاب مرحلة الخامس، إن شاء الله تسمعون الصوت الجميع. اليوم راح نتكلم، محاضرتنا راح تكون more clinical. It is about the fluid control and soft tissue management in fixed prosthodontics. You should know that the fluid source, before we discuss how to control the fluid inside oral cavity, you have to know what is the source of this fluid. As you know, the main source in the oral cavity is the saliva. Saliva is come from a pair of parotid gland, as you know, as you see in this picture, and pair of submandibular gland with a sublingual gland. All these secrete saliva inside the oral cavity. Okay, the parotid at the buccal mucosa, where below the tongue we have the sublingular or submandibular gland. Also, other source is the blood that comes from inflamed gingival tissue or any heterogenic soft tissue trauma during work, or gingival bleeding during tooth preparation. Another source, we have the circular fluid, and we have the water that come from the rotary instrument, a triple syringe, with dental material such as etching, irrigant solution. As you know, a rotary instrument اللي هي turbine, water float about 30 ml per minute. This the main source of saliva or fluid inside the oral cavity. Why we have to control the fluid during our work? To obtain dry, clean operating field, easy access and visibility مثل ما نشوف الآن بالصورة. Okay, when you isolate and control fluid, you will have more clean operating field, easy access and visibility, improve the property of dental material. Some dental material affected by moisture, their physical property, and protect patient well operator and improve the operating efficiency. Now, how we control the fluid inside oral cavity during our work? We have a different technique. We have one of these are the mechanical technique by using a suction device. Suction device, either low volume vacuum or high volume vacuum. Low volume vacuum الآن نستعمله بالعيادة اللي هو من خلال use of saliva ejector, and most of the time we have plastic or metal saliva ejector, plastic or metal. Most of the time we place it at the corner of the mouth, opposite to the quadrant that you operate. It helps to suck saliva during our work or water. We have another type of saliva ejector, is metal type. Okay, metal type. مثل ما نشوف it is metal saliva ejector attached with sometime with tongue deflector. مثل ما نشوف هاي بصورة. Sometimes we cannot, in order to protect the tongue during our work, we use this type of metal type of saliva ejector to retract the tongue. In addition, it helps in evacuate the water during your work. So the benefit of this type is to, in addition to suction, it will protect the soft tissue, اللي هو tongue, during your work. Also, we have, as we say, a high volume vacuum. When the flow is at high rate, sometimes you need a high volume vacuum to control the fluid during your work. طبعا fluid control it is during your work بالturbine and during حتى أثناء restoration procedure you have to control fluid, as we say, to improve the quality of the material used. Another mechanical method to control is using the rubber dam. طبعا الحقيقة rubber dam, we have different type of rubber dam, but the main action of this benefit of this rubber dam is to isolate and provide good accessibility to the working area. الفائدة مع الربر دام الايزوليشن ايضا كان isolate more than one teeth، مو مثل يعني مثل ما نشوف بالصورة الآن more than one tooth quadrant or arch كامل you can isolate it in during your work. طبعا الكراون بريدج sometimes is difficult to use rubber dam لأن احنا نحتاج نسوي during our preparation is to check the occlusion or relation of the abutment to each other, parallelism. For sometimes it's difficult to use the rubber dam in our work, but if you can use, sometimes we can use it in during construction of inlay only. It will provide good benefit in controlling the area from fluid. طبعا لما نستعمل preparation you have to have a high volume suction device with the use of rubber dam. اوكي طبعا اضافه للايزوليشن والاكسسبيلتي it retracts the soft tissue. اوكي مثل ما نشوف بهذه الصور. طبعا احنا ما راح نتكلم على الربر دام التفاصيل لان انتم اكيد ماخذين بالاندو، معطيكم محاضره كامله على الربر دام. but as a mean of fluid control we have الربر دام. The other mean of control is using of cotton rolls. cotton roll ايضا تعرفوها. طبعا cotton roll it is absorbent cotton roll place at the area of the source of the saliva. فما نعرف most of the time when we place it opposite to the area of the duct of salivary gland at the buccal fluid, buccal area as we see in the picture, buccal mucosa, or sublingual to prevent the saliva from submandibular, okay, or sublingual salivary gland as we see in this picture. Okay, sometimes we have a cotton roll holder in order to prevent displacement of the cotton roll by the patient, as we see in this, to hold in this picture, to hold the cotton roll and prevent displacement and provide good isolation area. In addition to that, sometimes we can use an absorbent card إضافة للcotton roll. Okay, these are a pressed paper wafer that may cover with a reflected foil on one side, and this will provide more control for the saliva from the buccal area, mucosa. Another mean of control is chemical method. طبعا chemical نقول chemical معناها you have to use a medicament. This medicament inhibit the parasympathetic innervation, and this will inhibit the action of myoepithelial cell of salivary gland, thereby reduce secretion. We have الدراج اللي تستعمل اللي anti cholinergic drugs. It will control, as we say, the blood flow, and they are, most of these drugs are anti-cholinergic drug and inhibit the action of myoepithelial cell. طبعا we have different drugs can be used. We have atropine, we have methamphetamine bromide, and we have propanthine bromide. All these drugs can use to control you can give the required dose for the patient before you start work. Also, some antihypertensive drug, such as the codeine hydrochloride, this drug, in addition to lowering the blood pressure, it improves the salivary flow inside the oral cavity. طبعا we have أيضا اللوكال anesthesia أيضا تعرفوا اللي بها أدرينالين تسوي vasoconstriction أيضا تفيد بالcontrol of blood. Now we finish the control. طبعا the control of fluid is needed, as we say, during preparation, during impression, during using of temporary, during cementation of your prosthesis. All these, طبعا, during your work, you have put in your mind all this way and how you can use all these. Sometimes you can use all these techniques together to control the fluid flow inside the oral cavity. Now, طبعا, you have, after your complete preparation of teeth, سواء for crown or for bridge, what you are waiting. طبعا احنا بعد ما نسوي preparation, the next step, طبعا as we say, احنا محاضرتنا اليوم كلها تقريبا clinical. راح نتكلم على soft tissue management prior to taking. طبعا هنا بعد preparation you have to take impression. So before impression you have to have to do what we call tissue management, soft tissue management before impression. طبعا tissue management is the key to having a good impression. Tissue management is the key to have a good impression. Tissue management, you need it before you prepare to take impression. We have the gingival, what we call gingival retraction or retraction of gingival tissue. طبعا انتوا يمكن بمرحله ثالثه المفروض ماخذين about this subject. Now we will go in detail how to do or control or the soft tissue prior to taking final impression. طبعا الجنجيفال retraction, as you know, is العملية هي عملية expansion of gingival sulcus. هذا الgingival sulcus, we sometime when we have the margin of the gingiva below the gum and we need to take impression. طبعا impression material راح توصل للسيرفس اللي هو ما مغطى. Okay. لكن when the margin is covered by the gingiva, definitely the impression cannot record the area of the margin of the preparation. So what we need to expose this area so that the material can flow at that area of the margin and give us a good imprint of the area. In gingival retraction, we are going to expand the gingival sulcus, so it gives us a space so that the material, impression material, flow at that area easily to record the detail of this area. Okay. طبعا الحقيقة gingival retraction is not need only during impression. Sometimes when the margin is below, during the preparation, we can use this retraction course so that we can prepare the margin, gingival margin, without any trauma to the gingival tissue. أيضا حتى أحيانا بالفيلينج we can use retraction to expose the gingiva. Okay. Before we start with the subject in detail, you have to know what we mean by the gingival sulcus. طبعا مثل ما تعرفون ماخذين البريو. الgingival sulcus is a shallow groove, V-shaped shallow groove, bounded by one side by the surface of the tooth, on the other side by the epithelial lining of the gingiva, of the free margin of the gingiva. V-shape, as we know, and the most its most coronal level of the epithelial attachment. مثل ما نشوف هذا هو الgingival sulcus. طبعا الgingival sulcus الدبث مالته يختلف from area to area, from patient to patient, وهذه يمكن ملاحظيها اغلبكم بال perio. Now we have a biological width. طبعا ضروري حتى حتى ما تسوي أي ضرر للجنجبة during your work, you have to know what we mean by biological width. The biological width is a dimension of soft tissue which is attached to the portion of the tooth coronal to the crest of the alveolar bone. هذا هو الكريست of alveolar bone. Okay. وهذه الgingival tissue اللي هي coronal to the alveolar bone. Okay. طبعا تتكون من ال connective tissue وال epithelial attachment. اكو proportional, definite proportion between the sulcus depth and the epithelial attachment وال connective tissue attachment. مثل ما نشوف بالصورة ال connective tissue attachment is about 1 millimeter, okay, and we have the epithelial attachment about 1 millimeter, while gingival sulcus depth is 1 millimeter. فأكبر proportional بيناتهم متساوي تقريبا. لما نزيد هذه أيضا يزيد الدبث. أوكي. هذا الاريا of connective tissue with the epithelial attachment نسميها biological width. What is the importance of this biological width? This biological width acts as a barrier to prevent the penetration of the microorganism, okay, into the periodontium, okay, and so that you have to preserve this width during your work, whether during tooth preparation or during isolation. لأن أي defect تسويه معناها شنو هذا البارير you affect it so that the microorganism can go through and cause an inflammation to the area. So care should be taken during isolation and extraction or during preparation to preserve this biological width and to ensure the healthy standard and maintenance of the normal value of periodontium. Okay. معناها لما نجي نشتغل بالجنجيفا margin during our preparation, you should be careful that bear to not go deeply inside the sulcus and affect the width of the attached gingiva so that it will affect the biological effect. Or when you place your margin of the crown, and should be no far away inside the margin inside the gingival sulcus. مثل ما نشوف هاي الصورة هذا الجم مثل ما نشوف شلون صايرة gingival severe gingival inflammation. ليش؟ السبب هو margin of the crown is within 1 millimeter of the bone inside the gingiva, go deeply and affect the biological width and produce inflammation or gingival inflammation area. طبعا بيجي حالة راح نحتاج تشيل الكراون نعيد الشغل to control the periodontium health, then we repeat our work. طبعا as we say من البداية gingival retraction main objective is to create access مثل ما قلنا you expand the gingival sulcus so that you create access for the brushing area to the area of the preparation that locates subgingivally. بمعنى انه لما يكون عندك finishing line above the gingiva you don't need to do a retraction. We do retraction when we have our margin with the level of the gum or below the gum, subgingivally. Also, to provide thickness of the impression material at the area of finishing line to prevent tearing and distortion. طبعا ال impression material most of them when the section مالته thin, it's easy to tear. لذلك we increase the thickness of the material by expanding our gingival sulcus. Also provide the best possible condition for the impression material. احنا قلنا when you طبعا جزء من الريتراكشن اضافه when we do a retraction there is a control on the fluid seepage. When so we control معناها dental material physical property we control the property of dental material and most of our dental material منها impression affected by fluid or moisture. طبعا we have different techniques to do gingival retraction. We have surgical, chemomechanical, mechanical. طبعا mechanical is by we apply pressure at the area of the sulcus, so the sulcus or gingiva will be expand physically to create that space. يعني عملية force مثل ما واحد يستعمل مثل ما نقول الخرطوم الماء او الصندة لما تجي تخليها بالحنفيه هي اصغر لما تفوتها راح will be expand. So نفس الشيء it is physical force that acts to expand the sulcus. طبعا we can use retraction cord, we have retraction crown with long margin can expand, copper band or tube, and we have anatomic compression cup, and we have matrix sandwich, rubber dam. All these can be used to create a mechanical force that expand the gingiva physically. Also, we have a chemomechanical. Here we have mechanical action and we have chemical action, يعني combination of mechanical or effect of some chemical material. We use it to later on we will discuss about it, such as aluminum sulfate, erythritol, ferric sulfide, zinc oxide. Most of these materials are vasoconstrictor. These are going to do vasoconstriction of the at the area of the retraction area. Or surgical, اللي هي radical technique. We have curettage, excision, electrosurgery, laser, and radio surgery. طبعا الميكانيكال مثل ما قلنا we apply pressure most of the time. طبعا التكنيك اللي اغلب الاحيان نستعملها بالميكانيكال هو استخدام الريتراكشن كورد. الريتراكشن كورد طبعا هو cord made of cotton, sometimes a combination of cotton and nylon. Okay, this cord is sometimes either plain free from any medicament or with medicament. احنا الان نتكلم عن الفري اللي هو with any medicament, so it will give us a mechanical action. مثل ما قلنا احنا different way to retract the gingiva. The most common way is to use, as we say, retraction cord. طبعا هذه different type of retraction cord هسه بنشوفها بالclassification. braided, twisted, knitted, these are according. Now later on we will see it. Okay. طبعا retraction cord have different classification. The main type of classification we have according to the chemical treatment, whether it come plain without any medicament, or it will impregnate with a vasoconstrictor اللي هو hemostatic agent. هذا نسميه impregnated cord, or sometimes classify according to the configuration, whether twisted or braided or knitted. مثل ما نشوف هنا هذه الصورة الشعر مال هذه البنت بالصورة، نفس الشعر لكن اختلاف شنو عندنا؟ عملية التسريحة. ممكن يكون twisted، ممكن يكون braided، وممكن يكون knitted. يعني ممكن يكون ملفوف، وممكن يكون معقود، اوكي، وممكن يكون مبروم، اوكي. هذا twisted. ممكن كل ديزاين بشكل يختلف عن الثاني بعملية التشكيلة مال الكورد. هذا مثل الشبكة يصير، وهذا twisted ملفوف، وهذا معقود آخر. اوكي. طبعا ال knitted cord is over advantage of other type of cord because it over a greater inter-thread space, اكو space بي، اوكي، than the braided والشيء الثاني form an interlocking chain of thousands of tiny loop, making it easy to pack and stay put when packed into place. بمعنى انه الباكينج مالته لانه اكو سبيس سهل، وايضا ما يصير بي displacement during packing the other when you continue your packing ما يصير بي displacement from the other area that you pack. So twisted or braided cannot provide over easy packability and tissue plate displacement مثل ما يوفرها لنا ال knitted cord. Another division or classification according to the diameter of the cord. مثل ما نشوف الآن لما تروح إلى أي مستلزمات طبية، لما تروح تشتري التراكشن كورد يجينا بعلبة مثل ما نشوفها. هذه العلبة أيضا بها نفس الكفر مالتها، بها بليد، تقدر لما تفتحها تقص الطول اللي تحتاجه. طبعا يجينا بالوان مختلفه مثل ما نشوف لون البلاك، لون يجينا اليلو بيبر، يجينا بلو، يجينا والجرين، واكو ريد. طبعا كل لون هو حجم، كل لون حجم يختلف عن الاخر بالدايمتر. الدايمتر اللي هو يتراوح بين 0.58 الى 0.86 من الاصغر الى الاكبر، فمقسمه حسب الدايمتر. زين. لما عندنا البلاك is 30 اللي هو the smallest. we have the yellow is 20 مثل ما نشوفه. 20 is اليلو اصغر، يكون اكبر من ال 30. most of the time black and yellow is used for the anterior لان عندنا thin gingiva. طبعا مثل ما نعرف الجنجفة diameter او depth of the sulcus is different from area to area and from the patient to the patient, so that you have to select a size that's that give you expansion. يعني ما ممكن تستعمل small diameter cord with a thick gingiva. بهيك حاله ما راح يعطينا الاكسبانشن اللي نريده، لذلك لازم تستعمل دايمتر يعطينا يكون حجمه مقاربه واكبر من الدايمتر او الويدث of the gingival sulcus. اوكي، ال 0 and 1 هي يكون دايمتر مالته اكثر من 30. اوكي، most of the time it's used for bicuspid و 30 و 0 used for anterior. and we have the green and red اللي هي large diameter واللي هو اكبر شيء اللي هو يتراوح بين 0.076 الى 0.086. هذا الدايمتر اللي هو we use it for the molar. Okay, sometimes they divide it into 3 group according to diameter: small, medium, and large. The small is used for the anterior when we have thin tissue present, and medium is indicated with the greater bulk is for the posterior, and large should be used with a caution. as طبعا لما يكون large وتستعمله الجنجفة هي الويدث مالته صغير, you might traumatize the gum. Like you should be careful in selection the diameter of the cord. مثل ما نشوف هذه كل diameter هذا 30 وهذا شنو 3 number 3, اختلاف بالدايمتر كبير. اوكي, الكيموميكانيكال اكشن. طبعا الكيموميكانيكال مثل ما قلنا عندنا بلين كورد زين او impregnated cord. الكورد لما you added or you soak it in a solution اللي هو most of the time vasoconstrictor, it's going to give us a chemomechanical action. mechanical action is going by force, mechanical force. Cord is expand physically. Medicament, most of these are vasoconstrictor, okay, such as adrenaline or aluminum sulfate or aluminum chloride. Most of the time we use aluminum chloride, and other might affect, especially if patient have any heart disease or بالcirculatory system ما نستعملها لأن might be side effect مثل ما تعرفون. فmost of the time we use aluminum chloride 10% to or 5%. هذا we soak the cord. It will cause a vaso when we place the cord inside the retraction in the sulcus. It's going to go. We will get a vasoconstriction of vessel. By this way, we are going to reducing the blood flow and the tissue fluid, and it will later on produce a shrinkage of the tissue that help in expansion of the gingival sulcus. The chemical action. So combination of chemical action and the mechanical provide better retraction for the gingiva. The cord can be packed with special instrument. As we know, we have special instrument. Most of the time we use a plastic instrument. إذا ما عندنا special Fisher packing instrument, you can use another plastic such as H6. You can use it. Most of these instruments have a round-ended, okay, and 3-sided round-ended. Other round-ended can pack the cord easily. Most of the time during your work, you need 2 instruments. One pack and one hold the cord. Okay, مثل ما نشوف, one is going to pack the cord and another hold, so that when you pack this area, it's going to prevent displacement of the cord from the other. Most of the time, this is the specially designed instrument اللي هي Fisher packing instrument, okay, from Ultra Pack company. their thin edge and fine serration. طبعا بيها serration بالاريا هذه مثل ما نشوفها الهيد مالتها. هذه السريشن sink into the cord, so it prevented it from slipping off and reducing the risk of cutting the gingival attachment. يعني تثبت كورد اكثر لانه بي سريشن. طبعا اكو نوع بي سريشن يجينا ونوع يجي without any serration. Okay. Most of the time, the initial placement of our cord starts from the interproximal area. يعني مثل ما تعرفون interproximal area هي السلكس بيها deeper than the buccal or the lingual. لذلك most of the time we start from interproximal, then we go to the buccal where we follow the gingiva to the other side. Okay. طبعا شلون عمليه نستعمل الريتراكشن كورد؟ how we use it. طبعا before you start retraction, as we say, you have to have a good isolation to the area so that you control the fluid حتى ما يأثر على action of this cord. You cut a segment of the from the retraction package. So if cutting a smaller diameter cord, الدايمتر اللي تاخذ most of the time حسب التوت as we say. طبعا كده this is a kind of knitted type of cord. تاخذ طول يتناسب مع circumference of the tooth. Okay. شوية أطول من circumference. زين. وبالتويزر سويه as a circle. Then عندنا هنا الفازوكونستريكتور liquid. The cord is immersed in the solution in the dipping dish, and then the excess solution plotted on a cotton roll مثل ما نشوف. يعني احنا الريتراكشن كورد ما نريده منقع بالمي ونستعمله، لا، احنا بعد ما يتنقع بالليكويد الفازوكونستريكتور نخليه على قطعه كلينس حتى يكون فقط مويست وليس full with the fluid، لان هذا will affect on during working with it. When you pack it يعني الاريا كلها راح تصير fluid وراح affect your packing ability والeffect مالته، راح صعب الباكينج مالته. لذلك what you need from this only to be cord moist with the vasoconstrictor. اوكي. لذلك بعد ما sometime طبعا يجينا مرات الكورد هو اصلا impregnated، يعني باكج بي هو impregnated with vasoconstrictor، بس most of the time يجينا هو plain. you need to add it شنو الفازوكونستريكتور اللي هو الومنيوم كلورايد as we say. بعدين نحاول نخليه على قطعه كلينز حتى يمص الزياده مال الليكويد. بعدين يو ستارت عمليه الباكينج مثل السيركل، تجي قاعده على التوث. طبعا most of the time we start as we say from a proximal surface using a smooth blade cord packing instrument. طبعا later on هسه راح اشوفكم في الفيلم همينه تشوفون شلون العمل مالته. طبعا we start from the proximal ونروح حول التوث. Sometimes السيركل نفسه you can tight it and you go through the interproximal area. Okay. As we say, we start from the مثل ما شفنا proximal area. Okay, packing the cord with a plastic instrument as ash or Fisher packing instrument. We start packing the cord. طبعا مثل ما قلنا الكورد will mechanically will push the gingiva away from finishing line, and the combination of the chemical action and the pressure exerted by the cord will cause transient gingival ischemia and بالvasoconstrictor والpressure, and this will lead to the shrinkage of the gingival tissue and control of fluid seepage from the gingiva. طبعا احنا retraction cord, when you pack it, after you pack, you have to leave it about 5 to 10 minutes. يعني you have leave it in the area اللي هي طبعا قلنا you control complete isolation area مسوي, and you keep it isolated and الى ان تخلص الاربع او 5 دقائق of to 10 minutes as we say retraction. بعد 10 minutes you have to remove this retraction cord. مثل ما نشوف هذا الريتراكشن after retraction crucial view after you assess. طبعا حتى تتاكد من الريتراكشن مسوي لازم تسوي لك crucial view by the mirror, so that by this view you can see all the margin of your preparation. طبعا الريتراكشن اهم شيء انه لما تستعمله لازم تكون الجنجيفال تيشو واحده من شروطها ان يكون healthy gingival tissue. اذا gingival tissue unhealthy you cannot use retraction cord, لان هذا راح يسوي لنا شنو؟ bleeding للاريا قوي. So لذلك when we have inflammation bleed easy, moisture prevent proper wetting of مو بس impression ايضا الريتراكشن. لذلك you have to control the health of the gingival area. يلا نسوي retraction. We have another technique of retraction نسميها double cord or dual cord technique, and this we use it when we have deeper subgingival preparation. مثل ما نشوف when we have deeper subgingival preparation, okay, أو أحيانا الsulcus is very deep, okay, the sulcus not allowed لأنه after removing the cord شو يصير لما نسوي cord, okay, single cord we use مثل ما نشوف هنا, لأنه depth of the sulcus is very deep والmargin below lie deeply. مثل ما نشوف لما خلينا sulcus still this area is وين صايرة قريبة من التوث. لذلك when you remove the retraction after 10 minutes, this allow the sulcus to close, not allowing the increase of what? The impression material. يعني شنو يصير relapse بالgingival tissue. So in this case what you need, we have to use 2 cord. الفيرست cord يكون thin طبعا لانه احنا السالكس هو في شيب مثل ما قلنا, معناها كل ما تروح ديبر الويث اقل, فلذلك شو نستعمل بالديبر اريا نستعمل small diameter thin cord, وبال فوقه بعده او نستعمل second cord يكون thicker type. By using 2 cord technique we can شنو expand the gingiva without relapsing when we remove the cord. Okay. مثل ما نشوف طبعا استعمال this technique need 1 millimeter of intact tooth structure remain 1 millimeter of intact tooth structure remain between the top of the initial cord and the preparation 1 millimeter. مثل ما نشوف هذا initial cord اللي هو small, you need about 1 millimeter, okay, between the margin of initial cord and the preparation margin. يعني تستعمل الاثنين. هذا الكورد لما ندفعه لازم باقي عنده رشفة 1 millimeter وين between the margin and the margin of the initial cord. إذا ما عندك هاي المسافة ما ممكن تستعمل دبل كورد تكنيك، لانه ممكن نسوي تروما للتشو وما راح تفيدنا باي عمليه ريتراكشن. And you should be careful to exert excessive pressure on the tissue which can damage the epithelial attachment اللي هي effect on the شنو biological width. مثل ما نشوف هنا ما عندنا 1 ملم نشوف الوضعيه. اوكي. طبعا indication of this dual core technique when we have impression of multiple prepared teeth, impression for compromised tissue health, tissue health and excessive gingival fluid exudate. طبعا during the impression ايش راح نسوي هنا؟ بعد ما نسوي retraction we remove only the large diameter cord, we leave it the small. لذلك شنو راح نقدر اذا عندك multiple tooth preparation الريلابس يخف، مو مثل ما اذا عندك multiple preparation استعملت one cord لما تشيله من كل الاريا ممكن يكون اول واحد صايب ريلابس. By using the dual core technique leaving the small diameter after retraction هذه تمنع الريلابس of the gingival tissue وتبقى الاكسبانشن of the sulcus. Never pack dry cord because dry cord is harder to pack. Dry cord adheres to cervical epithelium and acceptable impression الطينة are more likely to that less than gingival response will follow. يعني سريع يعني نريد نسويكم قبل ما تخلص الوقت عندنا. The other technique is cordless retraction technique. In this we use a chemical material. This technique is non-traumatic, non-invasive, and excellent hemostatic into the gingival sulcus. Most of these materials produce good hemostasis and less discomfort. مثل Expazel, Resergil, Traxodent, Genium Trax. These are all the Gene من supplier material used for retraction. Most of these material are vasoconstrictor, control the blood flow in the area, يعني يسوي hemostasis. In addition of that, some type مثل magic foam اللي هو يسوي material مالته هو مثل silicone impression material. When you place it inside the sulcus, you inject inside the sulcus, going release ferrous and it's going to expand. So it will go during polymerization, يصير be expansion ويسوي enlargement للsulcus. طبعا most of these materials شافوا الاكشن مالتها when we use it مو قوي الا باستخدام شنو الهولو cotton roll. We place hollow cotton roll after you inject the material inside the gingival sulcus and we start from the interproximal area. Then you place شنو الhollow cotton roll and as the patient to close on it. طبعا هاي الهالوت راح تفوت بالسن وتضغط الماتيريال وين هذا المريض راح يصير راح يصير combination of chemical and mechanical. In such a case, this material can provide us better retraction for the gingiva. نشوف هذا الماتيريال خلينا الهالو تيوب بعدين ورا ما نشيله راح يعطينا better retraction للاريا. While when we use it alone ما تعطينا الريتراكشن اللي نريده. اوكي هذه عمليه هذا فيلم بدنا نشوف الريتراكشن مثل ما نشوف نخلي الريتراكشن كورد ونسحبه هذا ابر نسحبه ابيكالي راح يفوت راسا وين بالانتربروكسيمال اريا والبليتال اريا. اوكي then we pack the other area مثل ما نشوف هذا الفيلم حتى تشوفون شلون عمليه الباكينج. اوكي طبعا بعد ما اسوي له باكينج راح اتركه لمده 10 دقائق طبعا هذه هنا راح نشوف التكنيك اللي هي الكيميكال ماتيريال يوز اللي هو كوردلس تكنيك. مثل ما نشوف هذا يجينا كبسول ويا سبيشال جان.
So what I'm going to do is start in one area, and I'm going to go very, very slowly.
Okay.
And what I'm trying to do is to place this in between the gingival tissue and the prep tooth. So I'm going to go very slowly around.
مثل ما نشوف we continue from the interproximal or follow the circumferential of the tooth to inject the material inside the gingival sulcus. After that بعد ما نشوف هسه نشوف بعدين راح يخلينا الهولو كوتون حتى يصير pressure.
One of the things I like to do is actually take a little piece of this is a comfy cap that is made out of cotton. And what I like to do is actually kind of just tuck the material to make sure I have it in the sulcus.
طبعا ممكن نستعمل الكوتون رول تفرغها من الداخل وتيجي تخليها على التوث و ask the patient to bite on it.
The ideal time to leave this in is 2 minutes. And so after 2 minutes now what you're going to do is go in and completely rinse it off. And you do that just with a water spray. So I'm going to go in and just completely rinse this off.
هذا هاي suction device مثل ما نشوف وهذا الwater spray cleaning after you finish.
All right, now you can see
the
margin. Now we have retracted the tissue so we can visualize all the margins 360 degrees.
Okay.
We have no hemorrhage. So now we're ready to capture a great impression.
Okay. هذا أيضا نشوف طبعا احنا نشوفكم كل طرق مختلفة للتراكشن بس حتى تشوفوها. هذا التكنيك هذه starting from the interproximal you tighten the cord so that it go easily interproximal, then you pack, follow the circumferential of the tooth. Use the retraction pack up to retract the tooth, to pack the retraction cord all around the tooth. طبعا combination of the hemostatic with the retraction cord. وممكن combination of two retraction double technique نقول هسه. هذا طبعا يزيد عملية شنو؟ قلنا الفازو كونستركشن والهيلينج يقللها. هذا الأذر cord, this is the double retraction cord. هذا larger diameter. I start packing. So we have this technique is double retraction technique. Okay. إن شاء الله تكون واضحة الآن. Another technique for retraction اللي هي طبعا this technique is surgical technique الحقيقة تابع للsurgical هي rotary gingival curettage or gingitage. It is a toughening technique involving preparation of the tooth subgingivally while simultaneously cutting the inner lining of gingival tissue. يعني أثناء preparation you can use the diamond pair طبعا diamond pair go subgingivally طبعا لازم تكون highly experienced عندك حتى لا تسوي تروما للتشو. اوكي بهيج حاله you go subgingival بالدايموند تسوي مثل القشط للانر جنجفه. اوكي طبعا لازم الجنجفه تكون healthy no bleeding لما تستعمل on propping. the depth of the sulcus should be minimum 3 mm لما نستعمل التكنيك هذه. Disadvantage of this technique, instrument has poor tactile sense, the turbine multimeter, or sometimes we can use الكافيترون أيضا ممكن يفيدنا السكيلر بالتكنيك هذه. It can potentially damage the periodontium. Okay, مثلا if you use well done along with the finishing line preparation اليوم يورو preparation مثل ما نشوف تبدي تنزل وين gingivally. Portion of gingival circular epithelium is removed using torpedo turbine diamond. Improved ductile sense and piece is run very slowly حتى تحس sensation يصير عندك لازم مو تكون high speed. Water spray is important. Retraction cord is sometimes we use retraction قبل ما نسوي العملية يعني you place retraction cord inside the gingival sulcus حتى you expand the area حتى تقلل التروما. اوكي مثل ما نشوف توربيدو دايموند والكورد بليس وين ومره ما نخلص تيجي ايضا تخلي كورد حتى تسوي العمليه. اوكي هذا التوربيدو مثل ما نشوف اول شيء نخلي كورد. اوكي هسه نشوفها هذه الروتري جنجيفال كورتيج. هذا after you pack the cord inside the gingival sulcus نشوف الآن هذا طبعا يستعمل السكيلر أو سكابترون تيب اللي هي دايموند يستعمله أو ممكن تستعمل منه الترباين. زين ممكن تستعمل ترباين بس سلو سبيد راح تروح gingivalي to widen the area يعني مو سوي تروما بالجنجفة لا عملية مثل قشط اللاين التبطين مال الجنجفة يسوي اكسبانشن اكثر. اوكي بعدين تكمل ريتراكشن الاذر كورد وتكمل عمليتك مثل ما شفنا قبل شويه. اوكي اوكي وخلص العمل بعدين يو ريموف ذا كورد وتكون متهيئ للعمل. اوكي الاذر تكنيك اللي هي سيرجيكال الكتروسيرجري. طبعا الكتروسيرجري هو using of high frequency electrical current to cut the tissue and control the bleeding. It's used to remove the gingival tissue. Okay, improving access for the gingival margin with the advantage of control the post surgical hemorrhage. Okay. طبعا to indicate when we have area of inflammation in gingival tissue where the retraction cord cannot be used for minor tissue removal and control post-surgical hemorrhage. We use it sometimes مثل عندنا main contraindication of this is when we have thin gingiva, when the patient have electronic medical device and metallic restoration. هنا هي عملية using electrical current يتحول إلى يعطينا heat وهي عملية الكاتنج تبليبي. اوكي هذا العملية using of electrosurgery مثل ما نشوفه. واخر شيء عندنا هو using of soft laser. Soft laser can be used. It is very good hemostasis مثل ما نشوف بالفيلم. Perfect antibacterial, precise recontouring of gingiva, no gingival recession, no discomfort of the patient. An example of laser that used is diode laser. Okay, but the main disadvantage of this technique is very expensive لأن أجهزة الليزر كلش expensive. طبعا احنا بهذا نكون انهينا our subject. اوكي نتمنى انه الجميع يكون فهم الموضوع هذا وسيطر. ان شاء الله المحاضرة الجاية تكون عن الامبريشن ايضا هي clinical. most of the lecture will be clinical. إذا أي استفسار أو أي سؤال ممكن تكتبوه بالكلاس روم وممكن نجاوبكم عليه. أوكي. طبعا الحضور الآن راح ينزل لكم بالموقع وتبدون تكتبون حضوركم. أوكي. عندكم ربع ساعة للحضور. أوكي. و thank you very much for your good listening.